Hi, and welcome back to Holistic Tips with Nicole. Today's video is about Alzheimer's disease, and it's a topic that's very near and dear to my heart because my paternal grandmother was diagnosed with Alzheimer's in her mid-80s, and I lived with her most of my life. She was like another mother figure to me, and I lived with her during the time of her diagnosis. So to watch the slow mental decline and her awareness of it at times was absolutely heartbreaking, and it went on for several years. So I wanted to find ways to help prevent turning that gene on within myself, within other members of my family, and so that's what we're going to be discussing in today's video. If that sounds like something you'd be interested, then please keep watching, and don't forget to subscribe for more holistic content like this. Alzheimer's disease is a neurodegenerative disorder with progressive mental deterioration, loss of memory, and the inability to carry out activities of daily life. In the United States, the prevalence of Alzheimer's disease is now estimated to be 1.6% before the age of 74, with the rate increasing to 19% in the 75 to 84 age group and to 42% in those above 84 years of age. Alzheimer's has distinctive neuropathologic features that include plaque formation, amyloid deposition, and neurofibrillary tangles. The B-amyloid protein fragments accumulate to form hard plaques between neurons, blocking the transmission of messages and leading to the death of brain cells. Genetic factors play a major role and are estimated to account for up to 70% of cases of Alzheimer's disease. Although genes play a significant role in determining susceptibility to Alzheimer's, lifestyle and environmental factors also play significant roles, as in most chronic degenerative diseases. Poor quality diets with excess saturated or trans fatty acids may predispose neurons to environmental toxicities. Some data suggest that abnormal sleep-wake cycles and decreased morning light exposure may play a role in the expression of Alzheimer's disease. Traumatic injury to the head, chronic exposure to aluminum, exposure to neurotoxins from environmental sources, and free radical damage have all been implicated as causative factors as well. The tremendous increase in Alzheimer's disease parallels the rise in type 2 diabetes and insulin resistance, suggesting a possible connection. It's well established that individuals with type 2 diabetes have a 1.5 to 4-fold higher than normal risk for Alzheimer's disease, as well as vascular dementia. Measures to improve glycemic control appears to be an important step in the prevention of Alzheimer's disease. Considerable attention has focused on the association of aluminum concentration and significant evidence that it contributes to Alzheimer's disease. Even in those without mental disease, elevated aluminum levels are associated with poorer mental function. And aluminum appears to come from the water supply, food, antacids, and deodorants as the primary culprits. The primary areas of intervention from a natural medicine perspective include addressing prevention. In the advanced stages of Alzheimer's, however, natural measures will provide only limited benefit. Food choices consistent with the standard American diet are associated with a significant risk for the development of Alzheimer's disease. A diet high in saturated fat and trans fatty acids and low in dietary antioxidants may lead to increased serum and brain concentrations of aluminum. Adherence to a Mediterranean-type diet is associated with decreased cognitive decline, just as it is with a reduced risk for cardiovascular disease. Recent prospective studies have provided clear evidence that following a Mediterranean-type diet is associated with slower cognitive decline, reduced risk of progression from mild cognitive impairment to Alzheimer's disease, reduced risk of Alzheimer's, and a decreased all-cause mortality in Alzheimer's patients. The key dietary factors that reduce Alzheimer's risk are higher fish consumption and omega-3 fatty acids, monounsaturated fatty acids primarily from olive oil, light to moderate alcohol use, primarily red wine, and increased non-starchy vegetable and fruit consumption. Given the ability of the Mediterranean diet to reduce inflammation and improve insulin sensitivity, it's assumed that this action may be of extreme importance in its ability to reduce Alzheimer's disease. Polyphenols found in grapes, grapeseed extract, and red wine have been shown to prevent B-amyloid formation, which is huge. Even something as simple as celery may offer significant protection against Alzheimer's disease. Celery and celery seed extracts contain a unique compound that's both responsible for the characteristic odor of celery and its health benefits. This compound significantly reduces total cerebral B-amyloid plaque deposition and lowered brain B-amyloid levels. Encouraging the avoidance of all known sources of aluminum, aluminum-containing antacids, aluminum-containing antiperspirants, cooking in aluminum pots and pans, the wrapping of food in aluminum foil, and the use of non-dairy creamers certainly seems appropriate. Aluminum is also found in baking powder and table salt because it's added to keep them from becoming lumpy. In addition, citric acid as well as calcium citrate supplements appear to increase the efficiency of absorption of aluminum. Aluminum absorption can be decreased by magnesium because magnesium competes with aluminum for absorption, not only in the intestines but also at the blood-brain barrier. A diet rich in magnesium is recommended. Try to focus on unprocessed foods, avoid milk and dairy products, and increase the consumption of vegetables, whole grains, nuts, and seeds, which are all good sources of magnesium. Fruits and vegetables contain an array of antioxidant compounds beyond nutritional antioxidants. Some of these may exert specific effects of considerable benefit against the pathophysiology of Alzheimer's disease. Although severe thiamine deficiency is relatively uncommon, except in alcoholics, many Americans do not consume even the recommended daily allowance of 1.5 milligrams, especially in the elderly. A significant percentage of the geriatric population is deficient in one or more of the B vitamins. Given the essential role of thiamine and other B vitamins in normal human physiology, especially cardiovascular and brain function, routine B vitamin supplementation appears to be worthwhile in this age group. Alzheimer's may simply be the result of chronic low intake of essential nutrients, key among them being B vitamins. Another key B vitamin linked to Alzheimer's is vitamin B12. Vitamin B12 deficiency results in impaired mental function, which in the elderly can mimic Alzheimer's. Vitamin B12 deficiency is thought to be quite common in the elderly and is a major cause of depression in this age group. Correction of an underlying vitamin B12 deficiency can significantly improve mental function and quality of life. A great deal of research has been conducted over the past decade with L-Acetyl carnitine in the treatment of Alzheimer's disease. Research has shown that, we'll call it LAC for short, that LAC is of benefit not only in patients with early-stage Alzheimer's, but also in elderly patients who are depressed and have impaired memory. In one double-blind study of 236 elderly subjects with mild mental deterioration, the group receiving 1,500 milligrams per day of LAC demonstrated significant improvement in mental function. Ginkgo biloba extract has also been found to be beneficial in the prevention and early treatment of Alzheimer's disease. It should be taken consistently for at least 12 weeks in order to determine its effectiveness. Although some people experience benefits within a 2 to 3 week period, most will need to take ginkgo for a longer period of time in order to see any significant changes. There is also considerable experimental evidence that curcumin found in turmeric protects against age-related brain damage and Alzheimer's disease in particular. Researchers began exploring this effect after noting that elderly residents between the ages of 70 and 79 in rural India who eat large amounts of turmeric have been shown to have the lowest incidence of Alzheimer's in the world, 4.4 times lower than that of Americans. So there remains the possibility that curcumin might be one of the most promising compounds for the development of Alzheimer's therapies. So in summary, the primary therapeutic goal for Alzheimer's disease prevention is the initiation of therapy as soon as any signs of dementia are noted. You want to avoid aluminum, which is found in many antiperspirants, antacids, and cookware. Follow a generally healthful dietary and lifestyle plan, employing the principles of the Mediterranean diet. Achieve an ideal body weight, which helps to improve insulin sensitivity. Intake whole foods. Decrease high glycemic load foods and unhealthy fats. Replacing any B vitamin deficiencies. Taking L-Acetyl Carnitine 500 milligrams 3 times a day, as well as Ginkgo Biloba 240 to 320 milligrams daily. Thank you for watching today's video. If you have any comments or questions about your experiences with Alzheimer's disease, I'd be happy to hear from you and support you through the process. No one knows better than me what it's like to watch a family member suffer through something like this, so I'm happy to support you in any way that I can. I'll see you all next time.